Okay, so I've been told I need to smile more, so here it is. This is probably the last time I'm going to smile in this video. All right, my name is Dr. Geronimo, and this is probably the most important video that I've ever made. Today, I'm going to give you guys an important diagnostic tool that could possibly save your life. It's called the coronary calcium score. And what it is, it's a CT scan of your heart that identifies the major arteries and looks for calcium deposits or blockages in those arteries. Now, as you probably already know, heart disease is the leading killer in the world. In the United States alone, over 600,000 people a year will die from heart disease. And though the rates are skewed a little bit more towards men, roughly about 250,000 of those are going to be women. Okay, so just to kind of keep things in perspective, breast cancer claims roughly about 40,000 women a year, and so heart disease is up to 6 times higher than that. Okay, those are shocking numbers. I actually lost my own mother to heart disease a couple of years ago, and so hopefully with the information that I'm giving today, I can save you from experiencing your own tragic event. Okay? All right, I do have my own scan that we'll go over, but before I do, let me diagram the heart to show you what you're going to see. Okay? So, universal symbol for the heart. Hopefully you guys can see that. The heart is actually divided into 4 different chambers. Okay? Let's label this the right, label this the left, and just for general knowledge, the right side of the heart pumps blood into the lungs, and the left side of the heart pumps blood to the rest of your body. Okay, so the main arteries that we're looking for are going to be the right and left coronary arteries. Okay, now the right coronary artery will come around and go towards the back and become the posterior descending artery. Okay, there's also a branch that comes down here. It's called the acute marginal, or maybe just a marginal branch. And then the left will come down and it becomes what's called the left circumflex, or just the circumflex artery. And then it also has a branch that comes down here, and this is what's called the left anterior descending. Now this right here is what's called the Widowmaker. Okay, a severe blockage in this area can result in death, and so when you're looking at your scan, that's exactly where you want the most minimal amount of calcium deposits in there. Okay, so what we're looking at is the CT scan is going to look at different levels of your heart and identify where these blockages are. Okay. And then it's going to give you a score. Okay, so 0 is no evidence of heart disease or no evidence of calcium deposits. 1 to 10 is going to be very mild. 11 to 100 is moderate. Okay, 100 to 400 is pretty severe, and anything over 400, well, you've got to make some changes, because right now, if you're over 400, you're basically a ticking time bomb and you're at a higher risk for having a heart attack. Okay, so let's take a look at the shape of my own heart. That is a Backstreet Boy reference, and if you got that, then you probably need to get this scan done because you're at that age. All right, here we go. Okay, so this is exactly what you're going to see when you do a CT scan of your heart. Now, this is my own personal scan, and let me orientate you so that you know what's going on. So this is the very top part of your heart. This is the right side, and this is the left side. Okay, everything that you see in pink is bone, and that's exactly what you don't want to see in the heart blood vessels. Okay, so this is my breastplate or my sternum, and these are my ribs that go all the way around towards the back. These are my massive pecs right here. Okay, I can't take myself too seriously. So obviously the ribs go all the way around and connect to the vertebrae. This is my spinal cord that looks pretty cool right there. and this is a spinous process, or basically the spine of your back. Okay? So, as we scroll down, the two main arteries that we're going to see first are the left coronary arteries. And as I said earlier in my diagram, you're going to see the left circumflex first, and you can kind of see I've got some calcification going on in there, and that's actually where I have the most calcification, is in that left circumflex artery. So we're continuing this scroll down here, and now you can see a little bit more pink in that area. I actually scored a 10 in this left circumflex, and you're going to see as I scroll down even further that there's different areas of calcification in that left circumflex artery there. Okay, now you're going to start to see that left anterior descending. This right here is the Widowmaker. Okay, this is the one where you want the least amount of calcification, because that's basically what can cause sudden death right here. So my score is actually a 4 in this area, which is fairly mild. Obviously the goal is to have 0 or nothing down there, but that's the Widowmaker right there. Okay, as we scroll down, you're going to see different parts of the right, and you can see there's that left circumflex again. I've got some pretty good calcifications going on in there. But you're going to see the right coronary artery right here. Okay, and I do have some minor calcification there. I scored a 1. So what happens is you total up all of your calcifications, and that's basically your score. So with me, I got a 15. This is a 1. The left anterior descending, I got a 4, and then the left circumflex, I got a 10. So in total, I got a 15. Hopefully when you get yours done, yours is maybe even lower than mine. That'd be great. But obviously, if you score over 400, at least you have a tool now to actually tell you, hey, you've got to make some changes in your life, right? If you've got, kids, if you've got young kids, maybe you want to stick around a little bit longer to see them get married and to see them have their own children and enjoy being a grandparent. So this is a good tool to have for you to help you identify what changes you need to make, because heart disease is, again, the #1 killer in the U.S., and this is a tool that can help you identify what's going on in your heart. Now, the procedure itself is actually quite simple. There's no prep time, there's no fasting, there's nothing that you need to drink, and there's no dyes that you're injected with. You basically lay down in a CT tube. It does its thing for about 2 to 5 minutes, and then you're done. Now, you are exposed to a small amount of radiation, so it's not something that you want to have done every day, but this is a valuable screen that will help you to identify where those calcium deposits are so that you can start making some changes today. Okay? If you've liked this video, please share with others, give us a thumbs up, and don't forget to subscribe so you get access to all videos, future videos. Take care, guys. Bye-bye.